Hello and welcome to today's live stream. Have you ever wondered which nursing specialization is the best fit for you? Well, today we're going to delve into the world of nursing and we're going to compare two popular specializations: mental health nursing and adult nursing. If you're new here, my name is Diana, and this channel is all about mental health awareness, general health and nursing topics, and providing insights for navigating the challenges of nursing school. Thank you so much for joining me today as we discuss a common dilemma that's faced by many nursing students: choosing between mental health nursing and adult nursing. This live stream is going to be packed with valuable insights. We'll dive into what each specialization involves. We'll talk about their key differences, and then we'll also explore the factors to consider when choosing the right path for you. But before we start, please let me know in the chat, which nursing specialization do you think is the best? Are you leaning towards adult nursing? Or are you leaning towards mental health nursing? Or are you completely undecided? Let me know in the chat. Well, here's how we'll break it down in this live stream. First of all, we'll talk about what mental health nursing and adult nursing are all about. We'll talk about the challenges nursing students face when choosing. We'll also talk about some key differences between the two nursing specializations. We'll talk about what factors to consider when deciding which specialization is best for you. And then I'll answer any questions you may have at the end. So if you're watching live, please drop your questions in the chat. And if you catch the replay, please leave your questions in the comments and I'll do my best to answer them. And please don't forget to like this live stream and subscribe to the channel if you haven't already. It really helps support the channel and keeps content like this coming your way. So, what do we mean? What is mental health nursing and what is adult nursing? Let's start with mental health nursing. Mental health nursing focuses on providing care and supporting individuals with mental health issues such as anxiety, depression, schizophrenia, bipolar disorder, OCD, and so on. Now, mental health nurses work in diverse settings. So you can find mental health nurses in psychiatric hospitals, you can find them in community centers, schools, prisons, and even in private practice. The role of a mental health nurse actually involves more than just administering medication and treating symptoms of mental illnesses. It also involves building long term relationships with patients, therapeutic relationships. It involves advocating for their needs. It involves providing emotional and psychological support. It also includes providing education, known as psychoeducation, to patients and their families. Now, mental health nursing offers the chance to make a real difference. It offers a high degree of flexibility, and it also offers a career with excellent employment prospects. Adult nursing, on the other hand, focuses on caring for patients aged 18 and above who are dealing with physical health conditions, from acute illnesses like infections to chronic conditions like diabetes, cancer, or heart disease. Now, adult nurses work in hospitals, they work in outpatient clinics, they work in nursing homes, and even in patients' homes. The job of an adult nurse is often more hands on than that of a mental health nurse, and it involves tasks like administering medication, wound care, supporting recovery and rehabilitation, um, It also involves implementing plans for tasks such as preparing patients for operations, administering drips or intravenous fluids, and blood transfusions. Now, adult nursing further promotes overall health and well being. And just like mental health nursing, adult nursing also offers the chance to make a real difference. It offers the chance of having a high degree of flexibility, and also it offers a career with excellent employment prospects. Now, it is important to note that there's an overlap between both nursing specializations. So, what both roles do is they share some core nursing principles such as patient care, advocacy, and teamwork, but their scope and focus differ significantly. Now, let's address the dilemma of choosing between these specializations, so mental health nursing and adult nursing. Now, a lot of nursing enthusiasts are often faced with this dilemma of choosing whether they want to specialize in mental health nursing or adult nursing. And this can be quite overwhelming. And it's also a tough decision to make, as both specializations offer unique opportunities and challenges. Both fields of nursing are also very rewarding, and but then they are very demanding as well in their own ways. Now, I've often heard people say things like, I'm passionate about mental health, but I'm not sure if it's right for me. Or I want to work with a variety of patients, but I feel like adult nursing is really broad. Now, if you're feeling this way, trust me, you're not alone. I also had to make this decision before I eventually decided to do mental health nursing. Now, the key is in understanding what each path offers and how it aligns with your personal interests, your strengths, your career goals, and the type of patient population you feel you will enjoy working with the most. That's why it's important to know your why, because it helps when you're faced with this sort of dilemmas. Your why is going to help you to choose the best fit for you. Now, let's explore some key differences between mental health nursing and adult nursing. Now, the first difference is the focus of care. So, for mental health nursing, it emphasizes emotional, psychological, and social well being. So, as a mental health nurse, you often help patients to navigate their emotions. You will help them to cope with trauma. You will help them to walk through their therapy plans. Now, adult nursing focuses on physical health. So, you're going to be treating symptoms, supporting recovery. You would also educate patients about managing their physical conditions. Now, the second key difference is the work setting. So, mental health nurses might work in psychiatric wards, they might work in rehab centers, or they might also work in community health teams. But often, mental health nurses work in a less fast paced environment compared to adult nursing. Adult nurses typically work in hospitals, in emergency departments, surgical wards, outpatient clinics, and it's often more fast paced and requires a lot of multitasking. The third key difference between these two nursing specializations is the type of patients. So, mental health nurses would work with patients who may have long term mental health challenges, sometimes over months or even years. While adult nurses would usually see a wide range of patients, often for shorter periods during acute illnesses or surgeries. So, with mental health nursing, most times the patients will be in hospital for a really long time. While for adult nursing, the patients will come in, they get treated, and then they go. So you get patients, you see a wide range of patients for shorter periods. They come in, they get better, they leave. It's it's not like in mental health nursing, patients don't get better, but most times the mental health challenges are long term, and most times they stay for months or even years. The next key difference is the skills that are required. So, for mental health nursing, you require strong communication skills and emotional resilience. This is because you'll be dealing with complex psychological issues. Um, Whilst adult nursing requires technical skills like IV administration, wound care, like I mentioned before, physical health assessments, as well as the use of specialist equipment. The next key difference between these two specializations is in terms of the job opportunities. Now, in recent years, mental health nursing has become a lot more popular and is growing. And this is due to increased awareness about mental health. But a lot of people find mental health nursing emotionally tasking. While adult nursing offers more diverse opportunities since physical healthcare needs span, a lot of physical healthcare needs span across all demographics. So, to evaluate your options, it's important to think about the factors to consider when choosing between mental health nursing and adult nursing. And the first question you would need to ask yourself is, what is my passion and what is my interest? So ask yourself, do you feel drawn to understanding mental health, or do you just prefer hands on care for physical conditions? The next question you want to ask yourself is, what are your strengths? Are you good at emotional communication and empathy? If your answer is yes, mental health nursing might be a better fit. Or are you detail oriented and you thrive in a fast paced environment? If you answered yes to that, adult nursing might suit you better. Next, you want to think about what your long term career goals are. So, think about where you see yourself in maybe 5 to 10 years. Do you want to work in a hospital? Do you want to work in a community, or do you want to work in a private setting? Which specialization aligns with those goals? Next, you want to consider demand and job security. Now, both fields have high demand, but depending on the region where you are, you might have more opportunities in one specialization than the other. Now, you also want to consider volunteering and previous work experience. So you may choose to use volunteering to just test the waters. If you haven't experienced both fields yet, try to shadow professionals in both areas. So, shadow professionals in mental health nursing, shadow professionals in adult nursing. And then, if you have worked in a clinical setting before, you would easily be able to decide which field of nursing you feel more passionate about. Um, so, just like a summary of all of this to wrap up, both mental health nursing and adult nursing offer rewarding career paths. There's ample opportunities for growth and development. But it is just essential that before you make that decision, you weigh your options carefully and you choose a specialization that aligns with your passion and your career aspirations. And if you're finding it difficult to choose between mental health nursing and adult nursing, there's actually a fantastic option to consider, a dual qualification. Now, what this pathway does is that it allows you to gain expertise in both fields, equipping you with a broader skill set and making you highly versatile in the job market. Employers usually value dual qualified nurses because of their ability to provide holistic care, as they are able to address both the physical and the mental health needs of patients. Now, this skill mix not only enhances your employability, but it also opens doors to a wider range of roles from hospitals to community settings. And it's a really rewarding way to combine the best of both worlds. Now, if you've found this if you found this today's session helpful, please don't forget to give it a like and share it with someone who is deciding on their nursing specialization. And if you're new here, don't forget to subscribe and turn on notifications so that you don't miss out on more valuable nursing content. Thank you so much for joining me today. And remember, whether you choose mental health nursing, adult nursing, a dual qualification, or another specialization, remember that you're making a difference in people's lives. In the absence of any questions, um, I'll see you in the next live stream. Thank you so much and bye.